This episode is for informational and educational purposes only and is not medical advice. Always consult a qualified healthcare professional before starting, stopping, or changing anything related to your health, medications, or supplements. Today we are going to talk in detail about GHK-Cu injections, what they actually look like in real life, what they feel like when you inject them, why you might notice redness or stinging at the injection site, and whether or not you need to think about supplementing zinc when you are using a copper peptide like this. I want this to feel like you are sitting down with someone who has actually gone through the experience, so you can picture it clearly and understand what is normal, what is not, and what is just part of the process. Let's start with what GHK-Cu actually is in a very simple way. GHK-Cu is a copper peptide, meaning it is a small chain of amino acids that is bound to copper. This copper is not just floating around randomly. It is part of the molecule itself, and that is important because it plays a role in how the peptide functions in the body. People are interested in it for things like skin health, tissue repair, inflammation modulation, and overall regenerative support. You will see it used topically a lot, but injections are where people start getting curious because they want more systemic or targeted effects. Now, let's talk about what it actually looks like before you even inject it. When you receive GHK-Cu in a vial, it is usually a powder that has a blue color to it. Sometimes it is a lighter blue, sometimes it is a deeper, more vibrant blue depending on the concentration and how it was manufactured. That blue color comes from the copper component. When you reconstitute it with sterile water, the liquid becomes blue as well. It can look almost like a very diluted blue sports drink, or sometimes a bit more intense depending on how much liquid you use. When you draw it into a syringe, you will see that same blue tint in the barrel. It is actually one of the few peptides where you can visually confirm that something is in there, which can feel reassuring, but also a little intimidating the first time. You are not injecting something clear. You are injecting something visibly blue, and that alone can make people hesitate the first time they do it. Now, let's talk about the actual injection experience. Most people are doing subcutaneous injections, which means just under the skin, not into muscle. Common areas are the abdomen, the thigh, or sometimes the upper glute area. When you pinch the skin and insert the needle, the initial sensation is usually just like any other small insulin syringe injection. It is a quick pinch, sometimes barely noticeable if you're using a fine needle. But here is where GHK-Cu can feel different compared to other peptides. When you start to push the plunger and the liquid begins to enter the tissue, you may feel a mild to moderate stinging or burning sensation. For some people, it is barely there. For others, it is very noticeable. It is not usually unbearable, but it is enough that you are aware something is happening. That stinging can last just a few seconds while you are injecting, or it can linger for a minute or two afterward. Some people describe it as a slight burn, others as a tingling sensation, and some say it feels like a mild irritation under the skin. This is one of the most common things people notice with GHK-Cu injections, and it is one of the main reasons people ask questions about it. Now, let's talk about what happens right after the injection. When you pull the needle out, you might notice that the area becomes slightly red. Sometimes it looks like a small pink or red patch around the injection site. In some cases, there can be a small raised bump, almost like a tiny welt or a mosquito bite. This can happen immediately or within a few minutes. The redness and the bump usually fade over time. For some people, it is gone within 15 to 30 minutes. For others, it can last a couple of hours. Occasionally, it might linger longer, especially if the injection was a bit more irritating or if the person is more sensitive. So, why does this happen? There are a few reasons. First, the copper component itself can be somewhat irritating to the tissue. Copper is an active element, and when it is introduced into the subcutaneous space, it can trigger a localized response. That response can include increased blood flow to the area, which shows up as redness. Second, the pH of the solution can play a role. If the solution is slightly more acidic or not perfectly balanced, it can contribute to that stinging sensation and local irritation. Not all preparations are exactly the same, so some people may notice more or less irritation depending on the source and how it was mixed. Third, the volume and concentration matter. If you are injecting a higher concentration in a smaller volume, that can sometimes feel more intense. If you are injecting a larger volume, that can also stretch the tissue more and cause a bit more discomfort. So there's a balance there, and people often adjust based on their own experience. Another factor is simply your own sensitivity. Some people react to almost any injection with a little redness and swelling, while others barely react at all. Skin thickness, hydration, circulation, and even the exact spot you choose can all influence how it feels and how it looks afterward. Now let's talk about something that a lot of people wonder about, and that is the blue color and whether it affects the skin. Occasionally, people notice a slight bluish tint under the skin right after injection. This is usually temporary and fades as the solution disperses. It is not staining your skin permanently. It is just the visual effect of that colored liquid sitting under the surface for a short period of time. Now, let's shift into the question about zinc, because this comes up a lot. GHK-Cu contains copper, and anytime you are dealing with copper, people start thinking about mineral balance. Copper and zinc have a relationship in the body where they can influence each other. Too much of one can potentially affect the levels of the other. So the question becomes, if you are using GHK-Cu, do you need to supplement zinc? The answer is not a simple yes or no for everyone. It depends on your overall intake, your diet, and your existing mineral status. The amount of copper in GHK-Cu, especially at typical doses people use, is relatively small compared to what you would get from dietary sources or high-dose copper supplementation. However, if someone is using it consistently and they are already low in zinc or they have a diet that is not rich in zinc, they might consider paying attention to that balance. Zinc is involved in a lot of important processes, including immune function, hormone regulation, and tissue repair. So maintaining a good balance between copper and zinc is generally a good idea for overall health. That does not mean you automatically need to start taking high doses of zinc. In fact, too much zinc can create its own problems and can actually push copper levels too low, which is not what you want either. It is more about balance than extremes. A practical approach for many people is to make sure their diet includes zinc-rich foods like meat, shellfish, seeds, and nuts, and to avoid excessive supplementation unless there is a clear reason. Some people choose to take a modest zinc supplement, but they keep it within a reasonable range rather than going overboard. Another thing to keep in mind is that GHK-Cu is not just dumping free copper into your system. It is part of a peptide complex, and the way it interacts in the body is more controlled than just taking a copper supplement. That is an important distinction that often gets overlooked. Now let's go back to the experience side of things, because that is what most people are really curious about. If you are new to GHK-Cu injections, the first time can feel a little intimidating. You see the blue liquid, you are not sure how it is going to feel, and you are wondering if that sting or redness is something to worry about. For most people, once they have done it a few times, it becomes just another part of their routine. They know what to expect. They know that a little sting is normal. They know that a bit of redness is common. And they learn how to minimize discomfort by adjusting things like injection speed, location, and volume. For example, injecting slowly can often reduce the intensity of the sting. Choosing a slightly different area can make a difference if one spot seems more sensitive than another. Making sure the solution is at room temperature rather than cold can also help, because cold injections can sometimes feel more uncomfortable. Rotating injection sites is another important habit. Even though we are not getting into medical advice here, from a general comfort standpoint, using the exact same spot over and over can increase irritation. Spreading things out can help the tissue recover and reduce the chance of persistent redness or sensitivity. Now, when should someone be concerned? If the redness is very large, very painful, or does not go away after a reasonable amount of time, that is something to pay attention to. If there is significant swelling, warmth, or signs that look unusual compared to what we have described, that is not something to ignore. Most of the time, what people experience with GHK-Cu is mild and temporary, but it is always important to be aware of your own body and how it is responding. Another thing people sometimes notice is a slight itching sensation as the area settles. This can be part of the same local response and usually goes away on its own. Again, it comes back to that idea that the body is reacting locally to the injection and the presence of the peptide. Over time, many people report that the sting becomes less noticeable. This could be because they get used to it, or because they refine their technique, or because the tissue becomes more accustomed to the injections. It is not always the same experience every single time, but there is often a pattern that becomes predictable. Let's also talk briefly about expectations, because this is important. GHK-Cu is often talked about in very glowing terms when it comes to skin and healing. While there is interest and research around it, it is not a magic overnight transformation. People who use it consistently tend to focus on gradual changes rather than immediate dramatic effects. The injection experience itself is just one piece of the overall picture. Understanding what is normal helps you stay consistent, and consistency is usually where people start to notice whatever benefits they are seeking. So if we were to summarize the experience in a simple way, you have a blue liquid that you inject subcutaneously. You may feel a brief sting or burn during the injection. You may see some redness or a small bump afterward. These effects are usually mild and temporary. And the question of zinc comes down to overall balance, rather than an automatic need to supplement heavily. This episode is for informational and educational purposes only and is not medical advice. Always consult a qualified healthcare professional before starting, stopping, or changing anything related to your health, medications, or supplements. Thanks for listening, keep learning, and stay curious.